and I also welcome you all to our beautiful country, Ghana. Please enjoy Ghana. Co-chairs of the 13th Interest Conference, Honorable Minister of Health, Mr. Kweku Agyeman-Mensah, members of the media, distinguished high table, distinguished ladies and gentlemen. I join all Ghanaians to congratulate the co-chairs, local and international organizing committees on the hosting of this important conference on HIV in Accra. Today, I wish to share my thoughts on an area that is very dear to my heart: elimination of mother-to-child transmission. Before I begin, I want to tell you a short story. Nana Ama is a 15-year-old adolescent living with HIV who recently gained admission into one of the secondary schools in Cape Coast. Nana Ama's mother, Auntie Ya, did not attend the antenatal clinic till 36 weeks of her pregnancy. At the clinic, she was diagnosed with HIV and given antiretroviral drugs to prevent transmission of HIV to the baby. It seems Auntie Ya failed to take her medicines because she died of HIV 2 months after delivery. Early infant diagnosis tests confirmed that her baby Nana Ama had HIV. Her grandmother took care of her after the death of her mother. Nana Ama had challenges with taking her medications and failed treatment on her first-line regimen. With the help of the healthcare workers, her grandmother managed to disclose Nana Ama's status to her. She was put on a second-line regimen with 6 tablets a day. Her adherence to the medications improved when she had a full understanding of the disease. Unfortunately, in her new school, she was unable to take her medications in the morning and evening because she did not want her friends to know about her status. As a result, her clinical condition deteriorated. Ladies and gentlemen, the story of Nana Ama clearly underlines the challenges we face in the transmission of HIV from mother to child. Fortunately, we have the tools and knowledge to stop HIV infection in children. There has been remarkable progress against HIV with reduction of HIV-related deaths. This notwithstanding, children are still left behind. In 2017, it was estimated that 180,000 new infections among children occurred globally. Majority of these new infections can be found in Africa, with West and Central Africa accounting for 21% of new HIV infections and 30% of global deaths. According to a 2018 UNAIDS report, Ghana had an estimated 3,400 new HIV infections in children under 14 years in 2017. Though this indicates a decline of 42% since 2005, we need to accelerate our response if we have to eliminate HIV infection in children. The good news is there are tried and tested interventions that have demonstrated favorable outcomes. We do not have to do anything new, but deliver these well-known interventions with commitment. We know that a significant number of pregnant women are teenagers, and we do know that teenage pregnancy declines sharply with education. Therefore, interventions among young women to prevent them from contracting HIV will be essential. Improving access to family planning services, girl-child education, and economic empowerment initiatives are likely to reduce age of sexual debut and unplanned pregnancies. We also know from the Ghana Demographic and Health Survey 2014 and Maternal Health Survey 2017 that over 97% of pregnant women received antenatal care from a skilled provider. In addition, 82 to 90% of these pregnant women receive more than 4 antenatal clinical visits. This affords us the opportunity to offer these women HIV testing. Every woman who tests positive must receive antiretroviral drugs. pregnant women who are HIV negative early in the pregnancy should be retested before delivery. This will ensure women who seroconvert and become HIV positive later in the pregnancy receive appropriate treatment. It is well known that HIV seroconversion later in pregnancy is associated with high transmission rate to the baby. Making antiretroviral drugs available to all HIV-positive pregnant women is a key to eliminating mother-to-child transmission. However, support must be provided so that these women adhere to their medicines to prevent transmission to their babies. Every child born to an HIV-positive mother should also be screened for HIV within the first 6 weeks of life and followed up according to national protocol. Any child who tests positive at any time during the follow-up should be initiated on antiretroviral therapy as soon as possible. Exclusive breastfeeding should be strongly encouraged whilst avoiding mixed feeding in the first 6 months of life. This will limit postnatal transmission of HIV. On my part, I have, in collaboration with Ghana AIDS Commission, working under WAFLA chapter, held health outreaches to advocate for accelerated elimination of mother-to-child transmission. At one of these derbes, I launched the National Acceleration Plan for Pediatric HIV Services, which hopefully will fast-track the implementation of critical services for adolescents and children and put 90% of all children and adolescents living with HIV on treatment by 2020. These outreaches were so successful that during the 2018 World AIDS Day, Abbott used the Ghana example as a case study to get other countries to conduct similar outreaches. In January this year, we launched the Free to Shine campaign with the objective to accelerate the pace of elimination of mother-to-child transmission of HIV and AIDS in children and keep mothers alive and healthy. There are several other activities planned by stakeholders with regard to this campaign and will be rolled out in the course of the year. Distinguished ladies and gentlemen, we need to learn more from implementation of elimination of mother-to-child transmission within Ghana and from other countries. I charge the Ghana Health Service to have a reporting system that identifies every single infant who is infected with HIV. We need to understand whether the mother attended antenatal clinic, tested for HIV, was offered and adhered to antiretroviral drugs, and practiced exclusive breastfeeding. This will fine-tune our program as we move towards elimination of pediatric HIV. This is feasible and can be achieved. With our collective knowledge, desire, ability, and commitment, we can win this fight. Thank you, and God bless you all.